Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr. Dawn Harper and I thought now might be a good time to give you an update on where we are with the coronavirus vaccine programme. I'm thrilled to tell you that we have given over 23 million doses of the vaccine here in the UK and over 1 million people have had their second dose of one of the coronavirus vaccines. You will have heard in the press about new variants that are emerging. Viruses do change and mutate. That's why we have a new flu vaccine every year to accommodate for those changes. So we expect the coronavirus to mutate, and at the moment we have a Kent strain, a South African strain and a Brazilian strain. They seem to produce the same symptoms, or as we've seen with the original COVID-19, they may produce no symptoms at all. There is some evidence that perhaps there is less of a loss of sense of taste and smell with the Kent strain, but really you can only differentiate between these coronaviruses using testing. You can't tell on clinical grounds alone. The good news is that the Kent strain seems to be susceptible to the current vaccines, and a small study suggests that the same with the South African strain, and work is ongoing to see how the Brazilian strain responds to the current vaccination. We will, of course, I suspect, need booster doses, and we may well have a situation where new strains develop that are not responsive to the current vaccines, and we will have to tweak the vaccines. I think it's increasingly likely that we may find ourselves in a situation like we are with flu, where we will have an annual vaccination programme and the vaccine will need to be adapted year on year in order to make sure that it is effective against any new strains. Those tweaks are relatively simple compared to developing a vaccine from scratch, so it's something that scientists are already aware of and know how to make those tweaks should they be needed. I'm often asked about vaccine passports, and this is something that the UK government are currently considering. I know there's quite a lot of feeling against such passports, but I think we may well find ourselves in a situation where we will need some kind of proof that we have been vaccinated. Denmark and Sweden are already working on some kind of passport system. I know that Saga are insisting on proof of vaccination before taking on one of their 2021 cruises, and Qantas are looking at some way of proving vaccination before you're allowed to board their planes going forward. So watch this space on where we're at here in the UK, but I think some kind of proof of vaccination will be increasingly required for certain forms of travel and to enter some countries. Before I go, I would just like to debunk a few myths. I hear a lot of people worried, certain religious groups or people who are vegan or vegetarian worrying about the vaccine because they've been told that it contains animal products. It doesn't, I can promise you that. So it's completely safe to have that. There are no animal products in the vaccine. There is also no evidence that it has any impact whatsoever on fertility. So please, if you are wanting to start a family, whether you're a man or a woman, there is no suggestion that there is any problem with this vaccination and fertility. And finally, I'd like to talk about the concept that has been whizzing around social media, that perhaps there is a chip that is inserted in this vaccine in some way, which means that governments can track your every move. That is absolutely not true. And just to kind of reassure you, I guess, look, if you were really wanting to track people, you wouldn't start by vaccinating those people who live in care homes or who are very elderly and are less likely to travel. So please, there is absolutely nothing in that. I'm a healthcare worker, so I've had both of my vaccines. My parents are in their 80s, they've had both of theirs, and my brother and my partner are awaiting their appointments, and believe me, they will be going as soon as they're invited. I hope that's helped you, and I hope as soon as you get your appointment sent through that you make your appointment a priority and stay safe.